My paper is the future evolution of IOL power calculation. It is based on the artificial intelligence based algorithm. The study is totally self-dependent, self-financed, not supported by any research grant. The purpose of this retrospective study is to compare the accuracy of widely used IOL power formula, namely the LADA Super and HIL RBF, that is artificial intelligence-based formula. Next, Barrett Universal Holiday 2, Holiday 1, and OfferQ and the HISES and ISRKT formula are the regulation formulas. When we upload the data of the patient, artificial intelligence-based formula finds distinct pattern in apparently random clouds of data points already created by large number of cases. Thus, it is based on the pattern recognition of artificial intelligence. It is purely data-driven and free from limitation of the expected lens position and free from the limitation inherent to the standard formula. It is adaptive, dynamic, and constantly evolving. Yes, in this retrospective study, detail of 267 patients were collected from our hospital who had undergone cataract extraction IOL implantation from January 2019 and March 2020. We include 379 eyes from 234 patients based on the inclusion and exclusion criteria of preoperative investigation includes IOL master 700 readings. That includes axial length, K readings, lens thickness, white to white, ACD, along with the complete examination of the eye. Patients are grouped in the term of axial length. Group 1 is the axial length more than 24.5. Group 2 is between the 21.5 and 24.5. Group 3 is below 21.5. After 1 month post-op, measurements are done by the same profession and same autorefractometer for best corrected visual acuity, post-refractive actual dioptric power, and the number of dioptric error. These are the inclusion and exclusion criteria of my study. This is the Excel data sheet of my study. For statistical analysis, SPSS software is used. Mean were shown as along with the standard deviation. Refractive mean numerical error, mean absolute error of the IOL formula at different axial length groups were calculated and compared. Refractive error absolute value by percentage of each formula is calculated at 0.25, 0.51, and 2 diopters. Mean absolute error is used as the indicator for the IOL formula prediction accuracy. Small as standard deviation of mean absolute error shows the accuracy of prediction error is good. Centroid residual astigmatism prediction error are calculated for each method for toric IOLs. Here in this study, it is 26 cases. These are demographic and pre-operative biometric ocular parameters of the patient. Now, from the data, we calculate the mean numerical error. Here it is seen that HIL RBF and LADA super formula gives them minimum numerical error, so they are better. Similarly, if you calculate the mean absolute error, here again the HIL RBF and LADA super formula gives the better results. If we analyze the sensitivity of the formula prediction at 0.25, 0.51, and 1 diopter, here again the LADA super formula and HIL RBF gives the minimal post-operative error with more eyes with 0.5 of the spherical equivalent. Is table showing the mean numerical error and mean absolute error and percentage of eye of absolute refractive error at 0.25, 0.5, and 1, 2 diopters of our formula. Here, the mean absolute error is smallest for LADA super formula, followed by the HIL RBF. So these two formulas are very good. For the extremes of eye, LADA super formula is better than the other formula because here again the mean absolute error is smallest for both the extreme eyes, like long eyes and short eyes. Toric calculator and post-LASIK calculator are yet to come in the LADA super formula. For post-operative LASIK calculation, no artificial intelligence formula is till now. For toric calculation, we use LADA super formula for the spherical part and Barrett toric calculator as a cylinder part. Issue of astigmatism can be compared in the centroid residual astigmatism error. This slide shows the centroid error in the prediction residual astigmatism for each method of calculation divided into with the rule and against the rule. Here, the combination of LADA super formula along with the Barrett toric calculator gives the excellent result. The same thing is shown in the double angle plot. There's the red circle in the center shows the Ladas over formula along with the Barrett-Kotori calculator gives the minimum error, and thus they are very good. Now, to conclude, the artificial intelligence formula is totally data-driven based on the pattern recognition without estimating the expected lens position. It is continuously evolving, and thus accuracy above 90%. Among them, the Ladas over formula is better as a single answer for all IVL calculation query. There is no outbound limitation as in HEAL RBF. It incorporates the sweet spots of many existing formula into one single formula. Ladas over formula is the grandmaster of biometry, and artificial intelligence base is the game changer for IVL par calculation. Thank you. Thank you for your patience here.
Thank you, Dr.